$100 for my surgery, which was my deductible or out-of-pocket expense for an overnight hospital stay with surgery.
So what would you tell people that maybe need this, that might not know the tips on how to...
The cost really, I think the most cost that I spent wasn't the $500, because I actually paid that off to the hospital. Like, I made a payment plan and I paid like $100 a month over a few months. But it's the co-payments for all of the specialist visits you have to go to get clearance for the surgery through your insurance company. So my insurance company at the time, I think, was Blue Cross Blue Shield. I had to have a cardiologist consult, pulmonary consult, the lung doctor. I had to have a psychiatry consult, 3 visits with a nutritionist, and I had to have at least a 5-pound weight loss to show my commitment to the surgery. So that took 6 months to do all that.
Okay.
So because you can't see the nutritionist every week. You go once a month. Those 3 months. So there's a specialist copay associated with each of those. So and then you see the surgeon a couple of times. So that's probably another $500. But then there's probably another $500 in learning how to eat properly, buying stuff you're not even sure you're going to like it, because everything changes when you wake up from that surgery. Your taste buds change. Everything changes because they've taken the surgery I had, the vertical sleeve gastrectomy. They took out 3/4 of my stomach. So everybody has that picture in their head of what a stomach looks like. Mm-hmm. Mine is just a tube now, and they take out this huge portion of your stomach, actually physically, and the area that creates the hormones that make you feel hungry are gone. The one, a lot of different systems change. So, I would say out of pocket, $1,500 spread out over a year. Most insurance companies pay for it. But actually, I work for a hospital now, and the hospital insurance I have, which is very good, excludes bariatric surgery. And I think that a lot of insurance companies might be going that way because so many people are doing it as an alternative, But it's actually, in my case, I had what's called comorbidities. The doctors will know what that is. I had diabetes, I had high blood pressure, I had a history of pancreatitis, and a history of diverticulitis, which are all weight-related or can be, traced back to...
So it was a health concern.
So it was a health concern.
Right.
So I would have been able to sail through insurance anyway because of the comorbidities, not just that my BMI was over 40 or whatever it was. I don't even remember what it was.
Right.
But I feel great, and I'm so glad I did it.
Thank you.